Good morning, Mr. Smith.
Good morning, doctor.
How have you been?
Okay, the
Yeah.
usual, getting on with life.
Yeah, from our last appointment that we
Yeah,
had.
been
Yeah?
okay.
Everything been okay?
Yep.
All right. So yeah, I've got your blood pressure
Okay.
reading Miss Judy took earlier. Um,
Is it okay?
it's slightly on the lower side.
Oh, so doctor, my pressure you said it's zero, but it's usually high. I have hypertension. Yeah. So from the last time that you came, we measured your blood pressure and it was slightly on the higher side. Okay. Today apparently your blood pressure is on the lower side. Yeah.
So I just want to ask you a couple of questions
Okay.
with regards to your blood pressure.
Mhm.
Okay. Have you been recently having symptoms such as when you do stand up from a seated position or from a lying down position? Do you feel a bit weak? Do you feel a bit lightheaded?
Yeah, come to think of it, I did feel those symptoms actually, especially when I'm waking up in the morning
Yeah.
from the bed, or even as simple as sitting down while watching television, and then when I stand, I
Okay.
do feel a little dizzy. But I've never fallen down because
Never fallen.
because of that. I've never lost consciousness.
Okay.
I did want to talk to you about my falls actually. So I think for the past 2 or 3 months I've been falling down quite frequently at home.
Oh no.
Yeah.
Okay.
Yeah, it's quite worrying.
All right. I just want to confirm. Currently, do you live alone at home?
Yeah.
Or you're living with?
I'm living alone at
Okay.
home. Yeah.
How about your kids? Do they come and visit you from time to time?
When they get their days off, yes.
Yeah.
But otherwise I'm mostly alone.
Okay. And have you injured yourself? You mentioned that you fell multiple times.
No injuries
No
so
injuries,
far. Yeah. But I mean, the moment I fall and then when I get up,
Yeah.
I do feel a bit sore.
All right.
But I've never gotten any injuries.
Okay. Do you have any ideas of what it might be?
Well, the stairs at home, they're pretty steep. I
Okay.
think it could be because of that.
Okay.
And my dampened vision, that's another thing. I think you know by now I have cataracts.
Yes. Let's take a look at our notes last
Yeah, I
time.
think it's been there for years actually, and especially at
Yeah.
night, I tend to see like halos around the light.
Okay.
Yeah, and it's really blur. Sometimes like faces are quite blurred.
Yeah.
It's worse at night compared to the daytime. So I think that worsens my
Yeah.
me tripping over and all.
Okay. All right. So, do you have any form of like rails? So what we'll do is, I'll write you a referral letter to the hospital where you can see,
Okay.
an eye specialist.
Yeah, sure.
To have a closer look at the
That'd be
eyes.
great, yeah.
Yeah,
That'd
and
be
see what can be done.
Mhm.
All right. Okay, Mr. Smith. Looking back at the notes I've written over the last couple of visits, it says that you've been having extensive amounts of pain, especially in your right knee.
Oh yeah, that's
Yeah.
been there for a long time.
Okay, so with regards to your knee pain, Mr. Smith, what I have to do is I would refer you to an orthopedic
Yeah.
surgeon,
Wait, what kind of doctor is that?
bone doctor.
Right. Okay.
Yeah.
Okay. Yeah.
And she will take a look at your knee,
Sure.
probably up the management
Yeah. Okay.
and dose for your for the treatment,
Okay.
and
So now I have to see like an eye doctor and a bone doctor,
yes,
right?
an eye doctor and a
Okay,
bone
I'll
doctor.
try to remember, right? Okay.
Don't worry, I'll have your referrals written for
Sure.
you
Thank you.
by our nurse, Miss Judy.
Sure.
All right. Okay, Mrs. Smith. Before we conclude our consultation, is there anything you would like me to do for you today? This
No,
evening?
I guess just sort out my falls problem.
All right.
Yeah.
Okay. So in that case, what we'll do is I'll review your blood pressure medications.
Okay.
Right. Yeah. So I'll check in with you. I'll get Miss Judy to check in with you in a week's time,
Okay. Yeah, that sounds good.
and
That sounds
I'll see you for our next appointment in 2 weeks' time.
good. Okay.
Yep.
Perfect. Thank you so
Alright.
much, doctor.
You're welcome.
The next day.
Hi, Mrs. Faye.
Oh, hi.
I'm Kai, your orthopedic surgeon.
Oh, hello, doctor.
Yeah, so how are you feeling right now?
I'm in terrible pain, doctor.
Alright, no worries. I'll give you painkiller as soon as possible.
Okay,
Alright.
thank you.
So I'm here to communicate some of the decisions from our team. So my colleague has attended you just now. Apparently you have a fall and you have a pain over your hip, right
Yes.
hip, right? So we actually did an X-ray and the X-ray shows that you actually have a broken hip right now.
Yeah, okay.
Yeah. So our suggestions would be doing a surgery to replace your hip.
Wow, surgery.
Yes. So
Okay.
what we'll do is we'll replace your hip and it will enable you to have a better quality of life in terms of walking. Yeah. Hi, Mrs. Mays.
Hello, doctor.
Yeah, how are you doing?
Oh, much better. Thank you so much.
Alright, so I'm very delighted to tell you that your operations, everything went very well.
Oh, that's excellent.
Alright,
Okay.
so we have done our part from the surgical department, so now we'll pass you over to the care under the physiotherapist. So this is our physiotherapist Daniel. Alright, so he will be explaining how you should cope with your new hip.
Wow,
Alright.
that's amazing.
Alright,
Thank you
so-
so much.
Yeah, I'll leave you
Hello.
here.
Okay.
Okay, good morning, Mr. Smith. Just to introduce myself, I'm Daniel. I'm one of the physiotherapists in this hospital. Okay, so first of all, I would say it's definitely a good thing that your surgery went well.
Yes, I have a
Okay,
new shiny hip now.
and then I understand that you are still having some pain in your hip. Is that
Yes,
correct?
that's right, yeah.
Okay, yeah. So even though you're having the pain, I need to tell you that we will need you to for these few days, we need you to regularly get up from your bed and have a short walk, okay? The reason why we need you to do that is because it will help with your recovery,
Alright.
okay? I understand that this may make the pain a bit worse, but if you need, we can prescribe you with some medication that can help reduce the pain.
Sure.
So is that okay for you?
Yeah, that's perfect.
Okay, and that's great. And there's another thing that I would like to have a talk with you is that I'm planning to book an appointment with you over the coming weeks, okay? And so the purpose of the appointment is to teach you some kind of exercises that can help strengthen your muscles, okay? So these exercises can help with the knee pain that has been troubling you.
Okay.
Are you happy to book the appointment?
Yeah, perfect, definitely.
Okay, so thanks very much for your cooperation.
Thank you so much, dude.
Have you see here? Daniel, you see?
Yeah,
I think the stairs here is a bit too steep.
yeah, I agree.
Maybe we can actually make another one here.
Yeah,
And then you see all the grasses here is a bit, can be very slippery when it rains, right?
Yeah,
So I think we should ask someone to clear this grass, all those things.
maybe.
And yeah, maybe we can also make a handle for
Yeah.
the patient. So you can have support, all those things. Yeah. I think that is the plan for now. We will see how we can help the patient and discuss with the patient. So what we can do. Okay?
I think that's a good plan.
Yeah, right. Hello, good afternoon, Mrs. Smith.
Good afternoon.
My name is Jack. I'm one of the occupational therapists in this hospital.
Oh, nice to meet you, Jack.
Right, nice to meet you. So I understood from the orthopedic surgeon that you had just underwent a surgery around your right hip. Is
Yes,
that right?
that's right. Yeah, that's
Right.
right.
So I'm glad that is a very successful one.
Yeah.
And the reason you are here today is because we want to provide you with a walking stick.
Oh, wow.
Right.
Okay.
So
okay.
basically, this is the walking stick
Oh,
that we
that's
prepared for you.
amazing. Okay.
Right. So I will show you how we actually use it.
Okay. Yeah.
So basically, you use it on the side where you have a surgery,
Okay.
and
So that's
just
my right.
just to support your walking, and you can walk like how you usually do. Would you like to
Right,
try?
okay. Yeah, yeah, sure,
Yeah.
of course. Thank you so much. I'll just start from here.
Just be careful.
Yeah, just like that.
Yeah, yeah.
Oh, this feels amazing.
That's great.
Thank you.
Right.
Thank you.
Okay. So you can have a seat.
Okay.
So of course, some people might not be very used to the walking stick.
Yeah, yeah.
And if you have the same problem, you can always come back and find us,
Okay.
the occupational therapist, or even you can find the physiotherapist when you're having these muscle exercises or
Right,
those things. They will know how to actually correct the way of using
Okay.
and make you more comfortable.
Right.
Would that be alright?
Yeah, that's perfect. Thank you
Yeah.
so much.
So I hope you have a speedy recovery
Thank you.
and have a nice day.
Thank you so much. You too.
Hi.
Hi, doctor.
Hi, good morning, Ginny.
Morning.
How are you feeling?
Okay.
You good?
Same old, yeah.
Okay. How have you been since the last time you
Been
visited?
okay. Been okay. I've been, doing my daily chores and stuff. Been okay.
Yeah? Moving around fine in the house?
Yep.
How are your kids doing?
They're okay. They're overseas right now,
Yeah.
doing their own stuff.
Okay.
It's just me and my birds at home.
Birds. So the reason why I called you to come in today is because I realized that there were certain things that I sort of picked up in the last consultation that we had,
Okay.
and I'm just going to sort of kind of explore more of the kind of symptoms that you were experiencing.
Sure.
Would that be okay?
Yep, that's fine.
All right. So you mentioned that you've been after the passing of your husband.
Mhm.
You felt lost.
Yeah.
You felt like you had no direction.
Yeah.
And I'm just going to sort of
Okay.
explore that a bit more. Okay. So you mentioned here that you've been feeling sort of you've been feeling a bit
Low. Actually.
low. So based on sort of the history that I gathered, it seems that you are suffering from some form of depression.
Right. Okay.
Okay.
That's what I thought. But okay.
Okay. So what I'll do is I'll prescribe some antidepressants.
Okay.
Okay. That will definitely help with your mood. Okay, but it'll take some time. It'll take
Right.
about 2 weeks or so for it to start
That's
working.
fine,
Yeah. However, though, when you do start the antidepressants, within the first 2 weeks or so, you might feel that your symptoms might get a bit more, severe, worse,
Okay.
right? You might feel like you're not getting any better.
Okay.
So people during this period in time, they tend to sort of want to harm themselves.
Right. Okay.
So if you do have any thoughts of such kind, you can, it would be ideal if you could just come to my
Right.
my practice,
Okay. Sure.
and come and see me.
Okay. Sure.
Okay.
No problem.
In the meantime, I will also write you a referral letter
Sure.
to a psychiatrist.
Okay.
Okay.
Yeah, that'll be great.
Yeah. So they are doctors who are specialized in treating these types of conditions.
Okay.
And he will take a closer look
Yeah.
and also maybe start you on with other therapies,
Sure.
like talking therapies.
Okay. Sure. No
Yeah.
problem.
Alright?
Sounds good, doctor.
Okay. Alright, do you have any questions?
No,
No.
that's it. Thank
Okay.
you so much.
Yeah, thank you so much. See you. Bye.